So this usually doesn't happen, that my model as a patient comes into my office and tells me that she fell and that I can find so many issues to work with her. So that's it's a nice gift, and I'm happy for her. I'm going to give her a treatment that usually how I start my treatments, so that she can go home uh, for lunch. It's lunchtime here, so on the next videos I'm going to do her evaluation. So what I'm going to do now is a myofascial release. I'm going to do the indirect myofascial release that I usually do on every single patient that comes into my office, and it's working on the transverse diaphragms. So you have the pelvic diaphragm, you have the respiratory diaphragm, you have the thoracic and the occiput. So when I release the diaphragms, what I'm going to do is a stacking of the tissues. So it's a indirect myofascial release. So what I'm going to do is, in the 3 planes of motion, I'm going to go left and right, medial, lateral, cranial, so up and down. So if I go one hand above, I'm going to have her sacrum, and I'm going to be able to also feel her 5th lumbar area. And I'm going to first allow the tissues to sink into my hand, allow the sacrum kind of to fall into my hand. Then I'm going to, at the fascial level, I'm going to stack in 3 directions. So I'm going to go to her right, left, and wherever she wants to go, I hold it there. Then I'm going to go up or down, and then I'm going to do wherever she wants to go, I hold it, and then I do a rotation, clockwise, counterclockwise. Where she wants to go, I just keep those 3 planes of movement, and I let go, and I just feel her tissue, her fascia relaxing. I will feel the therapeutic heat. I'm going to feel that it starts to unwind, and I keep the 3 lines of tension, or the 3 positions, and I just stay there. I become her fulcrum for her to unwind and allow the tissues to do what they need to do. Whenever the reason for me that it's so important to release all the diaphragms is because there are tissues that go transverse, in the transverse plane, and usually everything else goes longitudinal. So it allows for the artery, the vein, the nervous system, the lymphatics to flow. So I'm kind of opening the doors of our body, so for that everything can flow and move freer. Okay, so I put my cephalic hand towards her head, because when I put the hand that goes underneath is the one that's closer to her head, because it's if I would try to do above, I could come up, it's uncomfortable for the patient. This way, okay, so when you have a blanket or something, it will help you to put your hand underneath. If not, you can use the clothes of the patient. And I always have her, she doesn't need to help me. So I have my hand, I'm feeling her sacrum, I'm feeling her fifth lumbar vertebra. I put my hand and I just, again, I'm sinking in, for me it's important to be present, to keep my attention on what I'm feeling. My intention is for her tissues to soften, to unwind. For me, it's a moment that I'm communicating with her tissues. Like Roland Becker said, only the tissues know. And this is where her body is trying to tell me where she needs help, where she needs to be released. Then I hook my elbow and my hand, and I'm doing kind of like a compression. That way the sacrum is free into my lower hand. Again, I connect. No, I'm doing it a quicker version. And I'm feeling a lot of heat. I'm feeling the therapeutic pulse. I can feel everything unwinding, moving. I'm kind of going to do with my body kind of what I'm feeling, what she's doing. I can feel the sacrum relaxing into my hand. I'm not doing anything, just listening. I'm not trying to understand anything. I'm not trying to correct anything. This is a moment that I'm being present for her. Then I'm going to go into her thoracic. Si quieres puedes ponerlo aquí. Again. I'm going moving up, down, side to side. I'm exaggerating this motion just for the video, because usually you wouldn't be able to see anything. Rotation clockwise or counterclockwise. So wherever it's soft, wherever she wants to go, that's where I go. usually I stay a little bit longer on the diaphragm, the respiratory diaphragm, because I need to, it's very important to relax the diaphragm. The diaphragm has to be, you know, in a perfect place, and it for all the openings to be able to flow. You know, if there's a tightness in the diaphragm, the openings can be displaced, and that can contract and you know have an influence on the aorta, the esophagus, and all the openings that the diaphragm has. Then I go into the thoracic inlet diaphragm. Again, I have one hand underneath, one on top, and again, when I'm in this area, again, I have to be very present, and I feel, because there's so many tissues that go underneath this area. This is the area of the pericardium, the heart. There are so many important structures right now underneath my hand. When I do the transverse diaphragm releases, it's an opportunity to open the doors for a somato-emotional release. A lot of things can come up to the surface, especially if there are emotional issues that are going to be present. I'm just allowing, I'm allowing the tissues to relax, to unwind. Imagine if I have something stuck here. If I have a knot here on my blouse, can you see the tensions, the lines of tension in every direction? So with this myofascial release, what I'm doing is unwinding, allowing the body to unwind. I'm just being, you know, the instrument to help her do her own healing process. And I'm just helping in giving her the tools for her to be able to self-heal. I'm going to work also on her hyoid bone. Release. Remember, there are 16 muscles that attach to the hyoid bone. So if one is unbalanced, it will cause the other ones to become unbalanced. Here I'm going to do a suboccipital release. And my fingers, and no, pulling with my hands and kind of leaning back to create the small traction on the suboccipital. It's a, call it a suboccipital release or a suboccipital inhibition. I'm just saying there's also so many muscles attached to the occiput. This is a nice treatment, a very important treatment to, when we release the suboccipital region, it will create an activation of the parasympathetic nervous system, especially through the activation of the vagus nerve. After a fall that she had, her sympathetic nervous system right now is still on an overdrive. It's, you know, she's still in the fight or flight it's activated, so we need to regulate her central nervous system, bring balance between the sympathetic and the parasympathetic nervous system. And one last treatment that I'm going to do is the CV4, the compression of the fourth ventricle. That's where cerebral spinal fluid is produced, and it's a moment that when we do a compression of the fourth ventricle, a CV4, it allows to reset everything. It's to bring all the fluids into a still point and allow everything to reset itself. Like William Sutherland said, you know, if you don't know what to do the CV4. So the CV4, I'm going to rest her occiput on my thenar eminence. I'm going to do this, and they're going to rest here, okay? And I'm just going to, when there's in the extension phase, I'm going to do a slight compression. It's not even, you cannot even perceive that I'm doing a compression. I'm just allowing the tissues to, I'm feeling her rhythm, her craniosacral rhythm. Again, I am present. When she goes through the extension phase, I'm just going to hold it there, not trying to do anything. Just be present, have my attention on what's going on, listen to her tissues. Normal circumstances, I would have stayed longer. I re-evaluate her neck. I would go through a quick re-evaluation on her spine, her neck, her lower extremity, her upper extremity. This is also a nice treatment to kind of calm her nervous system. And I'm going to do my last treatment, which is the release of the pericardium release. I learned this wonderful treatment technique from my teacher, Montserrat Gascon, and first I'm going to do the technique, and I'm going to explain what I did. I put one hand on her pericardium, the other hand on top, and I'm going to kind of dance and move with her pericardium or her fascial system, and wherever I feel that I cannot go anymore, I press and I release. And I kind of close it. So the pericardium is the bag that protects the heart. It's like the guardian of the heart. So whenever there is an emotion, a fall like she had, the pericardium is going to be the one that contracts so that the heart can continue beating inside. So it's the protector of the heart. Physically, it has two connections here to the upper trap, to the occiput. So physically, when I do a pericardial release, it releases here at the upper trap and at the occiput. Emotionally, I let go of her old emotions so that new ones can come in. And spiritually, it's the kiss from heart to heart or from soul to soul, because I put my heart towards their heart. So whatever she needed is what her body received. And that was a treatment.